Welcome everyone to our national webinar event. As the Super Bowl draws closer and the gambling companies are intensifying, this ongoing siege of sports gambling ads targeted at the American people. The purpose of our event today is to really look at this massive storm of gambling advertising and promotions that has engulfed the United States, and to really spotlight why this is a dangerous threat to public health. So I am Les Burnell. I'm the National Director for Stop Predatory Gambling, and I will be moderating today's event. Our mission at Stop Predatory Gambling is to reveal the truth behind commercialized gambling operators to prevent more victims. And I strongly invite all of you to learn more about our work by visiting our website at stoppredatorygambling.org. We are fortunate to be co-sponsoring today's event with the Public Health Advocacy Institute at Northeastern School of Law. They go by the acronym PHAI. PHAI is a legal research center that's focused on public health law. They have current areas of focus that include tobacco control, childhood obesity, and predatory gambling. So just three logistical items for you in the audience, just so you're aware of this. To improve the viewing quality of this webinar, we respectfully ask you please keep your cameras turned off and your microphones muted. You're invited throughout this event to ask questions by submitting them through the chat function on the webinar. And then lastly, I think you all saw it when you signed in, but this webinar is being recorded, and our hope is that we'll have this, be able to distribute this later on today and later this week for folks who want to watch it. And so before I introduce our two speakers, I'm going to briefly recognize a couple of special guests in attendance today. Tom Gray is with us, and Tom Gray started to reveal the truth behind commercialized gambling operators more than 25 years ago, and he's a central reason why there's a national U.S. movement today for gambling reform. I also want to briefly mention Dr. Guy Clark, who's the chairman of our national board for Stop Predatory Gambling, whose leadership has helped grow our organization over 2 decades. And then it's really important to mention Dr. John Kent, who is with us. He is professor emeritus at the University of Illinois. He's been one of the nation's most preeminent scholars on commercialized gambling policy for a number of years, and he's recently served as the advisor to the must-read University of Illinois Law Review Symposium on Commercialized Gambling. And then, as you know, we have supporters that kind of span the world. We have a number of supporters internationally, and we have a few of them with us today. A couple of them definitely want to mention James Grimes, who is the Director of Education for Gambling with Lives, which is based in the United Kingdom. James is a national leader in that country for gambling reform, and we're honored to have him with us. And then we also have Dr. Samantha Thomas of Deakin University in Australia. She's one of the world's top researchers about the impact of commercialized gambling advertising on kids. And for all of you viewers, it's 4 a.m. in Melbourne. So good morning to you, Dr. Thomas, from all of us here in the US. Now to our panelists. Our first panelist will be Mark Gottlieb. He's the executive director of the Public Health Advocacy Institute at Northeastern School of Law. He is also a lecturer and a clinical instructor there. Mark is considered, without doubt, one of the top legal minds on public health litigation in the United States today. He has focused his research and his advocacy on tobacco litigation as a public health strategy for most of his career. But recently, he co-authored an article, Casinos and Addiction Industry in the Mold of Tobacco and Opioid Drugs, that was published in the University of Illinois Law Review. Our second panelist is Harry Levant, who is the Director of Education here with us at Stop Predatory Gambling, and he is a public health advocate from Philadelphia. He's a former trial lawyer who will receive his master's in professional counseling from LaSalle University in May of this year. He's a member of numerous professional organizations, including the American Counseling Association and Lawyers Concerned for Lawyers of Pennsylvania. Harry is also a gambling addict in recovery who made his last bet on April 27th, 2014, and he has dedicated his professional work going forward to helping people and families to overcome the struggles with gambling addiction and other substance disorders. And Harry, and you'll hear him today, really brings an uncommonly high level of expertise to this topic. because of his academic training as a counselor in addictions, his legal background, and his lived experience with commercialized gambling. So the first question I will pose to Mark Gottlieb is this. Mark, as someone who's been at the forefront of public health litigation to protect the public from the harms that tobacco causes, what's your reaction to this massive wave of commercialized gambling, advertising, and promotions that's targeting the American people today?
Well, Les, thank you. As you mentioned, I direct the work of the Public Health Advocacy Institute at Northeastern University School of Law, and I've been here now about 30 years. So going back to the early 90s, most of my work had been focused on the tobacco industry, and I've seen how in that time litigation, legislation, and regulation have helped to dramatically reduce smoking rates, and with it, the public health impact of tobacco products. And so I'm gonna get to your question, but I'm just gonna start with the tobacco industry, because back in the 1950s, cigarettes, much like gambling today, was a socially acceptable product, and the companies that sold them were considered pillars of the community with enormous political influence. They were actually considered the good guys back then. And we saw wildly misleading and irresponsible but highly effective cigarette advertising that was ubiquitous on television, in magazines, and on billboards. And this was really important for the tobacco companies as they addicted tens of millions, many tens of millions of Americans, almost all of them starting as teenagers. But because most of the harm from smoking takes decades to emerge, it took some time until we reached the point where we understood that smoking caused the early deaths of about 500,000 Americans each year, which is a lot. It's more than all drug overdose deaths, gun violence deaths, suicides, and traffic deaths combined. And it's more deaths per year than we've seen even at the peak of the COVID pandemic. So those are the numbers today, even though we have much lower smoking rates today, because much of the damage was actually done in the 1960s, 70s, 80s, and 1990s. And, while there were some voices back then sounding an alarm about cigarettes, they were often seen as just too moralistic and frankly, sanctimonious, which sometimes may sound familiar. Ultimately, though, it took a public health lens to understand the extent of the tobacco problem and how to get a handle on it. And it also took an acknowledgement that the industry itself was fundamentally dishonest and driven solely by a desire for profits, and couldn't really be trusted as a partner. And I see many similarities between the gambling industry and big tobacco. And while the analogy certainly isn't perfect, the two industries do share some striking similarities. Cigarettes are sold in packs where we fit in our hand easily and provide their smokers with the ability to satisfy the addiction whenever their brains tell them that they need nicotine by simply reaching into their pocket and grabbing a cigarette. And until recently, someone had to actually go to a casino or some betting parlor in order to place a legal bet. And now, in more than half the states, I think, gamblers can just similarly reach into their pockets for their phones to satisfy their need for action. Just like with addicted smokers, more and more gamblers spend increasing amounts of time thinking about their next bet. But reassuringly for them, like a pack of cigarettes, it's always within reach. And like advertising for cigarettes, the goal of the industry is not only to recruit new customers, it's also to remind existing ones that now is the great time for a smoke or to place a bet or two or 20. In addiction literature, this is called cueing, and it's designed to make the customers go from wanting a product to craving that product and then actually needing that product just to feel normal. In this case, the product sort of changes the brain. And it's precisely because gambling can change the brain that it's now classified in the DSM-5 as an addiction disorder, which is in the mold of cigarettes and opioids. And I think, today, Les, we're in like the 1950s and tobacco years when it comes to the gambling industry. In states with sports betting, the advertising is absolutely saturating the market, and everyone in those markets, is noticing it. It seems like it's overtaken ads for insurance, which I didn't even think was possible, and cars and even beer by a considerable margin. And with the big game coming up and other games coming in March, we can see it increasing even more. Like the cigarette advertising of the 50s and 60s, the ads are often actually woven into the fabric of the programming itself. They're not just standalone, they're part of the programming, which is what cigarette companies used to do. And also, like the tobacco ads of the 1950s, there's very little oversight of this advertising. Much of it is simply guided by a voluntary industry code, and in the 50s it was the code written by the Tobacco Institute, and now we have the American Gaming Association in 2022. Now I realize that, unlike smoking, gambling disorders thankfully do not cause lung cancer, but we shouldn't underestimate what the long-term public health consequences of ushering a generation of heavy gamblers, which is now underway, is going to look like. We know that it will include risks to housing security and homelessness, increased domestic violence and intimate partner violence, obviously debt and the consequences of the debt, which includes, family breakdown, and then, depression and unfortunately even suicide. And young people, particularly boys, are especially vulnerable. And judging by the advertising we're seeing and where we're seeing it, the industry understands its most important demographic. And this kind of reminds me of the Lorillard Tobacco Company internal document that was produced in litigation about their Newport cigarettes that stated that, quote, "The base of our business is the high school student." And so it is here as well. Of critical importance, the harm is not limited just to the addicted gambler. It's estimated that, every gambler suffering from some gambling-related problems will adversely impact maybe between 6 to 10 other non-gamblers, which could be members of their families, co-workers, friends, and just members of the community. And so, this isn't unlike the harms from secondhand smoke, which is estimated to cause nearly 50,000 deaths per year. And, is tolerated less and less, and has been for the last 10 or 15 years. And like smoking, in the case of gambling, the harms are often latent. It'll take years to really fully appreciate and be able to measure them. And, like smoking, developing a public health-informed policy response as soon as possible will be the key to limiting widespread harm related to the gambling industry's actions and products. A public health lens, shows us the importance of policies of prevention rather than just treatments for the health harms. In the COVID epidemic, right, which we easily see through a public health lens, since it's such an obvious public health issue, it's clear that an effective vaccine is the key to prevention, not the medications to treat the sick. And evidence-informed policies to place reasonable limits on the gambling industry can help to, in a real sense, vaccinate young people who all too easily can find themselves suffering from the consequences of an addiction to gambling. Now, Harry Levant knows this as well as anyone, and he'll go into some of the specifics less of what the industry is doing in 2022 and why it's critically important to begin the process of reining some of this in before it's too late.